Welcome! Thank you for joining me today. We're talking about how to prepare your child for a hearing test. We're also going to be talking about the different kinds of audiology appointments and what you can expect from the next couple of weeks or months after a diagnosis of hearing loss. So I want to thank you very much for watching. I hope we're not going to have any more technical issues, and thank you for watching in the replay and on YouTube. I'm Dr. Lilach Saperstein. I'm an educational audiologist. I'm also a clinical audiologist working in a hospital in Israel with cochlear implant patients and a lot of diagnostics. And I'm really excited to be sharing with you. Okay, good. We've got sound and video. Thank you so much, Pauline. So I'm really excited to share with you a couple of tips of how to prepare for an audiology appointment and to know what's coming, what's up ahead. I wanted to start by talking about diagnosis and why a diagnosis is so important. Have you seen the Netflix show called Diagnosis? It's with Dr. Lisa Sanders. It's on Netflix, and it's part of her project with the New York Times, where people with really rare disorders or rare constellation of symptoms that nobody can figure out, they go to all the top specialists, the best clinics and hospitals all over the world, all over the country, and they still can't figure out what's wrong with them. They can't get a diagnosis as to why they're having all sorts of mysterious symptoms. And when you watch this show, or at least when I watch the show, it is so moving. It is so difficult to watch the anguish that people really go through when they don't know what it is exactly that they have. Because the power of having a diagnosis is having information that you can then make decisions about the treatment or how to approach what it is that's happening. Even if there isn't a treatment, even if there isn't a cure, simply having a diagnosis and knowing what it is you're dealing with is really something that can give a lot of comfort, a lot of direction, and something that really resonated with me when I was watching a couple of these episodes, the search and the difficulty of trying to get the answer, and then when they get it, how much relief there is, whether or not that's going to actually help their case. It helps tremendously with being able to cope, with being able to understand what it is, where it came from, and just having some answers really is very powerful. And that's why getting a diagnosis of hearing loss can, of course, be a huge and heavy and overwhelming and difficult piece of news, but it can also be really valuable information. It can also be something that tells you where you're going next, what it is that your options are. And thankfully, there are options, there are decisions that need to be made. And now I just finished telling you how important it is to get a diagnosis, how great it is, how valuable it is to have one and then to have direction. But then you are left with many new decisions and new the next stage in the process. And that's something that I really want to address today, as well as talking about what are the different kinds of audiology appointments. Because understanding what are the different things that happen along the series or the journey after getting a diagnosis is really important to getting an overview of the next couple of months or next couple of years after your child is diagnosed. Then you know what to expect, you know what to prepare for, and you're not constantly being hit with all this out of nowhere, unexpected things, but rather you might feel a little bit more in control in an out of control situation. So what are the different appointments? Let's start over here. We have the hearing test or the diagnostic, trying to get information on what kind of hearing loss, how much hearing loss, is it one ear or both. This section of testing can either be automatic testing with ABRs, which is putting stickers, electrodes on the head and behind the ears. And this is a test where usually done on babies or young children, where we can get information about how the nerve is responding. It's an automatic test. Usually the baby is sleeping or very, very calm. And that gives us some information. We also, within this hearing test diagnostic phase, type, we also see the hearing tests that are in the booth, or hearing tests that require